Hi, this video is the hair transplant restoration surgery on a Caucasian man who has a receding hairline in both temples. So our goal is to recreate the hairline that is natural for him. On average, for Caucasian, from the mid-eyebrow to the hairline is around 7.5 to 8.5 centimeter. For Asian and Black, it's around 6.5 to 7. So we use the average height of an ethnic hairline as a guide, but really when we build the hairline, we build it according to each individual facial structure. Each person has his or her own unique hairline. As long as overall proportional from a third, from mid-eyebrow to the hairline is a third, from the glabella to tip of the nose of the third, and tip of the nose arch is a third. The more narrow the face, the more arched back the hairline is. The more round the face, the more flat the hairline is. So he had quite a bit of narrow face, so we arch back. And again, the hairline is a dimensional line. We don't have a straight line. We always dance zigzag up and down. The Asian and Caucasian have a little bit higher, bigger zigzag in amplitude versus African American men who have a smaller amplitude zigzag. Most African American men line up the hairline anyway, so we have such a big zigzag when they line up the hairline is a lot higher. And then for this client, he's not only have a receding corner, but he has a receding temple as well. You can see it went back a little bit on both sides. So the temple right here. So what we'll go is to not only lower the hairline, but we'll bring the temple in. Why? Because if we just lower the hairline, we'll bring our temple in. See, yeah, he has some hair. However, it doesn't look 100% natural because the forehead is still a little bit wide. As you know, I am such a perfectionist when it comes to restoring hairline. It has a lot of details, and when we pay attention to every meticulous details, that's how we create the artistry of the hairline and make it very natural. And so once we bring the temple in, got the shape down, we talked about the zigzag already. We would transplant at a very precise angle as 35-45 in the front. Increases when you go backward and changes when you go different direction. And then selection of hair grafts is important. We're trying to find rows and rows single hair graft in the front, followed by root to go 2 hair, 3 hair, 4 hair in the back for bulk and volume. I'm very excited for him because next year, after the hair transplant, his look going to be transformed. Once you frame the hairline, and he already a handsome guy already, but once the hairline frame his face, it will enhance his eyes, his nose, and all the features that God created for him. Again, at not only his look back, but his youth, 10 to 20 years of his youth back. So we will be attempting around 2,500 grafts with this project using the FUE method. FUE is the most advanced technology available and the least invasive of the two. When you compare the strip method, FUE is less painful, less bleeding, less chance of infection, less side effect. And FUE leave you tiny dots of scar versus the strip method, it leave you a linear scar in the back of the head. But the downside of FUE costs more, and we have to shave you more than the strip method. And the number of grafts we can harvest, around 2,500 grafts max per day, although there's days I can go beyond that, where strip method you can go a lot higher, number of grafts around 5,000-6,000 you can go. And that's strip method. I do both strip and FUE. And the strip for a client who have advanced hair loss, class 5 or 6. So this is the art of hair transplant of restoring hairline using the FUE method. Thank you.